I'm actually really looking forward to this panel presentation just because panels can be a lot of fun. So I have some questions prepared, but this is also a nice opportunity for more dialogue with all the wonderful people who came so far today to join us. So we're just going to have a few questions to start, but then we'll open this up to the broader group. And I know because everybody has such richness and depth of their own research traditions, there's a lot of nice ways to look at some of these very topical issues that we are facing. And so I think we'll just start by asking everybody to introduce themselves for the group, for those of you who do not already know everybody. And we'll start with you, Amy.
Hi, I'm Amy Sommer, and I'm in the Department of Health Management and Policy, and I have focused on leadership and teams in high-stress areas in healthcare and across industries. So I'll be speaking to crisis, especially today.
Thank you. I'm Brenda Vrkljan. I'm an occupational therapist by background and a professor in the School of Rehabilitation Science. And the area that I'm focusing on is long-term care. So the sense of belonging in which Dr. Bauma, Sheila, talked about earlier today, but that sense of belonging that is created amongst residents and the workers in that environment.
Hello, everyone. Thanks for hanging in. My name is Allison Williams, and I'm a professor in the School of Earth, Environment, and Society in the Faculty of Science. I'm trained as a human geographer, and I do health geography specifically. And my area of research is on carer employees, which are unpaid carers of adult care dependents who are also employed in the labor market. So looking at ways that the workplace can accommodate carer employees is my focus of research, very advocacy-oriented. Great to be here. Thank you.
Hey everyone, I'm Marisa Young. You met me last session. I'm in the Department of Sociology, and as of July 1st, I'm a full professor there. Yay! So I also do a couple things in my role here at McMaster, one being I direct a Center for Advanced Research on Mental Health and Society. And so as that suggests, I come to the issues of work and work challenges from a mental health perspective, particularly around issues involving the work-family interface, and so unpaid work, as well as how our neighborhoods and the communities with which we engage daily can help us to balance some of those competing demands across the work and family domains.
Thank you. So you can see this is going to be a really interesting discussion. So my first question is, the current global economy is facing more instability and crises than ever, with tariffs, political instability, and new challenges every day. Against this backdrop, what do each of you think is the biggest issue facing workers in Canada?
Well, it looks like I've got the microphone, so maybe I'll get us started here. So I'm sure many of you probably heard the news this morning that 750 workers in the Oshawa GM automotive plant were given a pink slip. So certainly I think first and foremost, there's a concern around employability, literally keeping one's job and consequently keeping families above water and keeping health sustainable. So that's certainly one thing that is top of mind. I think other concerns that come to mind for me specifically are rather EDI issues or DEI issues, inclusive, equitable work. Certainly, we're starting to see a little bit of that bleeding up into Canada from south of the border, given our connectivity of economies. So that's certainly another issue of concern that's at front of mind. So I'll pass the mic on to the next person. And I don't want to take all the wind out of everyone's sails here. I could go on for a while.
Microphone. I have said that. And you tried to give it to me too, and I almost had two microphones. I think I'll just build on what you said, Allison. I think the notion of health is complex, and then when we think about being a carer, what that can mean in terms of identity. And I'll speak to long-term care as well, which went through and continues to go through a crisis in terms of just the staffing and as well as some funding that's available. But I will say when something like this happens, right, and it's significant how it affects the community and then has sort of this ripple effect across different sectors. And, that ripple extends right into, if we think about that, I'm going to call it that part of life, right, where people are meant to be cared for, and then affects families if they're coming with stress, right, and that's a stressful time. Often when people move into that type of care, actually, I sat on a board, and that's what brought me to this work. Is that I sat on a board as a board member, a volunteer board member here in Hamilton with Thrive Group Services, which has long-term care facilities, and they're now my partner on the SHRC project. I've stepped away from being a board member. I served my 8 years, but wanted to remain involved in the sector, so partnered with them. But people generally only live 18 months now once they enter long-term care. So the stress that's on staff, the stress that's on families at that stage as well, is a lot. And then we can imagine the compounding stress in a community like Oshawa that's going to affect everyone. So I'll stop there, which may lead to mental health a little bit, Marisa, I feel like. But now I've just taken over the panel. So there you go, a little bit.
Thanks. Yeah, I'll just jump in and say, well, of course, I introduced myself in such a way, and will emphasize here too that mental health is first and foremost on my mind when it comes to workers today. And I think, particularly the points you brought up, Catherine, the instability and the insecurity. If we think back just a few years ago when we were faced with such an ambient stressor of COVID-19 and the consequences that had for our immediate mental health and well-being as workers, some protected more than others. But a lot of, those service workers and others who, automatically had to face closures and, unemployment and not knowing where their next paycheck was going to come from. And while we sort of talk about COVID as being, in the past, people are still recovering from that, right? And so when you think about mental health, it's very much like, if you broke your leg tomorrow, you're not going to all of a sudden just have a repaired leg. It's going to take a while of rehabilitation, and mentally, this is what we have to continue to do and support others too. And I think, we're in an economic situation where our workers are still recovering from that, but still facing these larger ambient challenges of insecurity. Understanding the work-family interface. This isn't an isolated experience. This is then something that spills over into the family unit. And so we have unhealthy workers facing those stressors, and then we have unhealthy families. And this has implications, of course, then for the next generation of workers.
Well, it's interesting to hear about different perspectives. And as we think about the current challenges with, as we heard today in Oshawa, but also thinking about the mental health issues and building upon COVID-19, myself, as one of my streams of research, looks at crisis management. So trying to take lessons across these different horrible situations that are unthinkable and what we can learn from them and also manage and do better in the future. And right now it feels like almost daily something's going on in the geopolitical atmosphere and just trying to figure out what do we do. And so first of all, some organizations have not consolidated their learnings from COVID-19. And my research suggests in hospitals and healthcare that some of the rules are relaxed and decisions were made quicker, and there was some of the bureaucracy that was lessened during the COVID crisis, but then some have returned to business as usual. So then it's slowing down again. And as we think about it, maybe some of those lessons of moving quicker for more nimble decision making could actually help us in healthcare or across industries. And so now bringing it to a broader lens across looking at the auto sector and the tariffs that are of course top of mind, and trying to navigate it for specific organizations and what that means for us. So thinking about the senior leaders and looking across the landscape, it's so hard right now. And one of the key elements are, what are the signals and what's the noise from daily activity? Is this actually going to be a problem for us, as we heard with Oshawa? Or is this just something that, it may pass tomorrow, depending on what's going on in the world? So figuring out what that means for us is really key across industries, not just in healthcare, which I specialize in, but also what do we do about it? So the senior leadership, that's one thing, but also they look externally and internally, our resources, and should we be cost cutting or looking to innovate or doing something else? So building on that and thinking about the different levels of the organization, I think is really important.
Mm-hmm. Okay, and so as we start to think about these issues, I'm curious to hear your perspectives on who are the vulnerable workers in these organizations, who are the most vulnerable, and how could they be protected?
Again, I've got the mic still. So I think, the area of research that I work in around care employees, has proven that they are extremely vulnerable. We know in Canada that they're 1 in 4 employees, and so 25% to 30% of our workforce is managing these 2 full-time jobs, and often they have young dependents as well. So they're certainly vulnerable. We know from Stats Canada data that 6 to 10% actually leave the workforce. So when they leave the workforce, of course, they're not only leaving their salary or their wage, but they're often losing their pension. And when we look at the social determinants of health, they're also often losing their social network, often their coping mechanism, because work offers a type of respite, their sense of belonging, their sense of purpose. And so many other determinants of health that we are continuing to learn more and more about as far as how they connect to work and the labor market more broadly. So, certainly that is one vulnerable group. I've got a few listed here specific to, for example, older workers, because we know the vast majority of care employees are spousal caregivers. So that certainly makes them vulnerable. We also have newcomers who are often doing what we call transnational caregiving, where they're remitting money back home to care for family, in addition to caring for their nuclear family here in Canada. So that is especially vulnerable because obviously it has international implications. I've got a few others listed here, but again, I'm going to let the other folks follow up. Would you like to go next?
No, we've got an order, so no, we don't. I know working with Dr. Bauma, Sheila as well, that she's, the way we frame and name things is important. And so she's, we started to name some of the projects, caring for the carers or healing the healers. And so this idea, right, that people have multiple layers, right? We talked about personal support workers, mostly racialized women in long-term care, and then having to, and it's interesting to hear you say things like transnational responsibilities, let alone going home, having to work between different jobs as well, long-term care, different homes in the community, and the responsibility of doing that in a larger center or even in a smaller center. And I've started to do some work not unrelated to this outside of Hamilton, imagine that, in some of our smaller communities like West Lincoln, and just trying to understand also healthcare and health in those areas, and to understand how people age in place in that area as well. So, and then the workers that are going to care for those populations, right? That want to continue to, as we said, age in place of choice. So I think there's lots to think about and lots of layers. I keep saying that word, but people carrying lots of responsibilities, I think. Am I going to break it up? Doesn't matter. Go for it.
In terms of the most vulnerable employees and how we can help, and first of all, identifying, and one thing my research is speaking to, looking across the older generation and some of the younger generation, and I hear a lot within healthcare especially that this is not our first rodeo of dealing with crisis in the past. It keeps coming back and repeating, whether it's COVID or H1N1 or SARS. There's been a lot of different crises, and certainly COVID's been most pronounced, but it's being longer and more intense than others. And as we looked at this and across the generations, it's certainly seeing it before and different ways to develop resilience. But some of the younger generation and the newer employees, they're struggling more as far as their support systems and the way that they develop resilience, and as far as being more on social media and less with traditional pathways to build resilience. So leaders and management being sensitive to this, and organizations helping support, especially the younger generation, is really key. And as far as the organizations themselves, my research suggests that often during crisis, they're so busy trying to deal with the external issues or dealing with the crisis itself. They're not always focused on the individual employees and resilience. So it's sometimes down to the personal leader on the front lines. They can help the team members and the employees most. And now that we've seen more than one crisis with COVID recently, as we heard earlier, but now daily it feels like there's a crisis, something new. Trying to look at the bigger perspective and what we've learned in the past and how we can help in the future for dealing with some of these generational issues and most vulnerable cases.
Thanks. And I think, it's one of those questions where there's not just sort of, one group that has been mentioned here by my co-panelists. And so it's sort of difficult to pinpoint who I would want to emphasize. So I will do so based on the research and the groups that I study. And particularly that's, parents and women with young children. And I'm not saying that they're always the most vulnerable to situations, but just thinking about these, the crises we faced, and even in institutions such as McMaster, if you're not aware, our team ended up doing a study a few years ago that actually looked at the impact of COVID on research faculty and research staff. And one of the things that really became apparent there is how women leaders really had to pick up a lot of the load when it came to what's called sort of emotional labor. A lot of you are probably familiar with that, but really having to take on, other struggles in the workplace as well as their own, as well as those who were at home. And, I see this now even more and more in current crisis. And so I think that we can learn some lessons about that, of how can we best support then those leaders on sort of the front lines when everyone else kind of has to take a step back for their own mental health and well-being. So I think, again, maybe not the most vulnerable in all of the current circumstances, but definitely a group that we have to pay attention to for that emotional load that they take on, in addition to the family load that they already have on their plates.
Okay, thank you. So my next question, making harder and harder questions for you. I'm going to stump you at some point. So Canadian companies are, of course, independent from the US. We are a sovereign nation, never 51st. However, we're frequently affected by what happens in the US. So how can Canadian workers and leaders protect themselves against such things as the erosion of workers' rights, especially around equity, diversity, inclusion, all these issues that we are seeing in the US? And I will also point the microphone elsewhere in case anybody would like to jump in as part of this important discussion. I have my own thoughts, but yeah, it would be better. So.
Well, I can get us started if that's okay. Yeah, I think, I was on a webinar recently. There was similar to what we're doing here today, there was a group of panelists talking about how we can engender career-friendly workplaces within an EDI framework. And if anyone hasn't heard about Anima Leadership, they're an excellent EDI resource that has much of their programming and educational offerings online. Anima, A-N-I-M-A. The director of which I directly asked, is career-friendly workplaces an EDI issue? And was very happy to hear that he, yes, believed it is an EDI issue. And, I think we have to really search for the silver lining in our Canadian workplaces, specific to how we can differentiate ourselves from the Americans. It's very clear that we have very connected economies that's changing very rapidly. The whole, elbows up, Canadian sovereignty. This is really differentiating us. And as we've learned from the recent federal election, it's also brought us together as a country. And I think that's been the silver lining of what's been happening stateside. I think we have to be cognizant of what the silver lining is with respect to EDI, how do we differentiate ourselves specifically around the axes of diversity that EDI represents, specifically around ethnicity, religiosity, sex and gender, unpaid care work, and so on and so forth? And how can we really scale up those differences in a way that makes us distinctly Canadian? And how is that going to be represented by us and seen, most importantly, on the international stage? So I'm thinking specifically here about our European comrades, if I may, right? How are they going to be viewing us as Canadians within this changing world, this very dynamic world? And it's not going to be easy, because I think one of the biggest challenges that we face is the dynamism of not only our economy, but of each and every workplace that exists within our economy. So that's going to be the challenge for us. So I think we really have to be very particular about finding that silver lining, celebrating it, and scaling it up to differentiate ourselves as a progressive economy that is cognizant about equity, inclusion, and diversity.
Yeah, and I thank you. That was, yeah, you have me right now. I'm gonna follow you wherever you're going right now. No, I think this notion of a cultural mosaic with an intersectional lens, right? I think we have it. I know even I was listening just now to you encouraging somebody to hold on to their second language, right? As a right, in terms of Anika, the conversation. Sorry, Anika, to point you out right now, but yeah, holding on to your culture, right? And that's something I think a lot of countries envy about Canada, that we have that and celebrate that. And I think that really differentiates us. But we do need to think about, I'm going to add to your mosaic or intersectionality, the notion of age as well. And it's something that's often overlooked. And because we have that population that's happening right now, that demographic shift, and that includes older workers as well in the workplace, which hopefully we can use their experience, right? And as you talked about, mentoring, right? And that's Kim's area too, right? But mentoring others, and I think that's something we can all think about. So I think this notion of the cultural mosaic, again, it's a bit cliche because we talked about that versus melting pot, right? But then that intersectionality and really driving that home. But I don't know, would you like to speak next?
Sure.
Excellent.
Thank you. So building upon this, my research, it looks at global leadership and more so across organizations, and also with looking at multinational and diverse teams, whether that be in other countries or here specifically in Canada. So speaking from a management perspective, there's things that we can do as leaders and organizations to help foster more productivity, because sometimes there's a divide as far as our values and where we're from. So in some cultures, it's seen as better to speak up and really focus on outcomes and efficiency. And this communication breakdown can happen where there's just silence in other places. Why is that? Is they don't care about efficiency or their productivity, or is there something else? And this is where deeply held beliefs in other cultures could be about consensus and about community and about hierarchy and waiting to get a sense of what else is going on before actually getting to the outcome. So it's not necessarily a focus on something different. They still want efficiency, but the way they get there is different. So us as managers and organizations, we can think about this, and as we structure the conditions to help foster diversity and productivity across different sorts of perspectives. From a management side, my research speaks to different tools that we can look at. So in Canada, I think, first of all, embracing this and the diversity we have, and then also being clear on managing what we face. And there are things we can do to help this be better. So as example, communication breakdowns, and my research speaks to decoding the silence as one of those elements.
I'm curious. Yeah, I'll just add a couple of points. So my research isn't specifically within this area. So I was thinking quite a bit about this question when Catherine sent us a couple prompts prior. And it's kind of like what's the saying? It's like the economy's stupid. It's like, it's the culture stupid, right? Like it's really about what can we do in our own workplaces in order to foster that understanding and respect, because I think we've seen time and time again that, policies, they can easily be removed, as we've seen, down south to us. And two, sometimes there's that rhetoric versus reality. You can say that we're creating a culture conducive to, diversity hires, but then when you bring those people in, and it's not actually fostering that type of culture. And so that is where I agree, management and others have to set that tone of what does a workplace look like that is going to accept and foster that. So, it's not just simply ticking boxes. And that's what I see as frustrating in a lot of the workplaces that I study or that I'm a part of, right? And so that's, it's kind of trying to think about then how that is put into practice. And I think it begins with our leaders very much setting that tone and respect levels, yeah.
Yeah, so those are varied answers, and it makes me think there could be others who might want to weigh in on this. So if there's anybody else, yep, Geraldina, here. Yes.
Hi, thank you. My name is Geraldina Plonko from Sociology. One thing that I also think about when we think about equity, diversity, inclusion, or just diversity in general within the current context is that when we have these moments of crises, we want to come together, right? And I think, as has been rightly noted, there's almost this revival of like, okay, what does it mean to be Canadian? How are we different from Americans? Then let's join together and be a more, a leader when it comes to questions of diversity. But within that context as well, I think it's also good to remember that during moments of crises, we start to define who is this we and who should be included within this context of the we, and in other ways, how can we continue to be competitive in this economy, start to be questions that politicians start to debate. And this is when we start to see things like borders being closed, right? So we start saying, okay, we're going to let in less migrant workers, too many international students, that's not good for the economy, and all these other issues that in a lot of ways are very anti-diversity, very anti-inclusion from a policy perspective. But when you're living the grind and when you can't pay your bills, when people are getting laid off, of course you're saying, well, we have to worry about us, right? And so I think that constantly entering in the public discourse that, look, like this is about larger policies and that there is a social support system that we can tap into, and we have to put in good policies so that some of these hardships that people are facing aren't experienced as such a hardship on the ground in people's daily lives, and that there are accountabilities that have to be met. I think that's where the effort really needs to go, right? When we think about families and childcare or elderly care, or people have even more complex issues, if a child has a disability or a parent has a disability, like what kinds of supports exist or don't exist? Like these are the kinds of things that actually make a difference in people's daily lives, but which don't get implemented, right? And of course, in the current context where we have a new government, and is a minority government. So how are we going to support and push that family-centered policies, people-centered, worker-centered policies actually get implemented? Like, I think that's what's especially crucial, while we also think about who are we leaving behind and who are we problematizing within that context, right? And particularly in the current era, it often is racialized immigrants, or those that we don't consider the part of the we that get left behind, and just draw attention that we need to be very careful we don't go there.
Mm-hmm. Thanks so much. Who else would like to add to that? Okay. If anybody is familiar with Timothy Snyder's work about how to fight against oligarchy, number one rule is do not obey in advance. So I'd like to think we would all agree to that. Another rule is to come together in person, look at people in the eye, and share that air together and have these discussions. So I think in our own way, we are fighting against oligarchy with this panel. It's great. So, yep, Martin. You have to, everyone knows you, but you still have to introduce yourself.
I don't think everyone knows.
Okay.
I'm Martin Horn. I'm the acting deputy vice president of research. I'm a historian. So some of you probably read The Guardian, right? This morning, I don't know if you saw it, there was a piece in The Guardian by Noah Ransom, I think his name was. And he said, we Canadians have in fact been telling ourselves a set of comforting S. That we're not committed to DEI, that we're not progressive, that we don't actually believe in a cultural mosaic, and that when a crisis comes to us, it becomes clear. So all I wanted to do was to ask our panelists to comment on that assertion and what they think of this. Are they in fact really much more like Americans than we care to admit?
Anybody want to go first? I will say, in the course of my own research on the temporary foreign worker program, I have met a lot of racist Canadians. So, yeah. But let's hear what the panel has to say.
Yeah, I'll just say I'm originally from Alberta, and I don't know if you saw, our MP in the area where my family is just stepped down to allow Pierre Pouliot to actually hold a seat there. And so I am well aware of, the myths of what we end up sort of trying to advocate or triumph, right? And so the realities, unfortunately, I saw very clearly growing up in that environment. I think that I don't really have a broader statement to say, but I understand the myths.
The only thing I'll just say too is in a place like long-term care, where people sometimes may not end up there by choice, that many people end up under one roof that wouldn't be there otherwise. And here in Hamilton, it's a larger home. Idlewild is one of their homes, and St. Peter's Long-Term Care, not St. Peter's Hospital, but St. Peter's Long-Term Care. And in fact, those are both the top-rated long-term care homes in Hamilton, but many different people from different walks of life are under that home. Same with the workers. And in fact, when there were higher wages offered within the hospital sector, some of them went, right, were attracted by wages, but then decided to come back to Thrive Group because of the culture that was there and because of the home. And I'm going to come back to the sense of belonging. So we need to unpack why does that work at St. Peter's? What can be taken then to other long-term care facilities? But all that to say, I'm not, again, this notion of, wider context of Hamilton being cultural mosaic, but I think there are examples in our society. Unfortunately, we can always find the racist person, I'm going to say, right? I have another, you brought it up. So I'm just staring at the person that brought it up, but I just feel, I feel quite strongly that I've seen the opposite, and I'm going to hang on to that.
Mm-hmm. And as I think about healthcare across our local neighbor, and often people look to the US and Canada and compare across different healthcare systems, and we're very different. And I've also lived in the US and France and looked at healthcare globally. And as far as the US model, and looking to us as the neighbor, and just as far as a value we hold very dear is our healthcare system and being publicly funded and trying to help healthcare for everyone. And in the US, a very different system. And we're actually more a hybrid as far as a closer comparison, looking also at Europe. And that's a better comparison than our local geography as far as different systems. So we have the public system, and then also Europe's more a hybrid in some countries, and then the US being a very different system. So I think there are a lot of differences. It depends on which sectors you're looking at. But certainly, as you mentioned earlier with your question that you raised, which is important, that there is definitely some issues to be considered as far as what's similar or not, depending. I think it's sector specific. As personally, and looking at healthcare is more of my expertise. I see a lot of variation personally.
Yeah, and finally, I think, we have to be cognizant of the fact that Canada asserts itself as a welfare state. So we're actually more in line with the Scandinavian countries than we are with our friends south of the border in the way we think and in the way we look out for one another, particularly those who are more vulnerable. And so even within our federal election platforms, we've seen discussion around what the federal government is going to be doing in order to assist those folks who lose their jobs, in order to assist those folks to put money on the table, right? So I think fundamentally when we think about Canada, we see ourselves more in line with a welfare state that takes care of the most vulnerable. And I think what we're seeing stateside is in fact the opposite of that. There's going to be a growing divide between the rich and the poor, even greater than what it is right now. In the United States has one of the greatest gaps between the rich and the poor. It will only grow further under the current administration. And so what we have to do here in Canada is really fight that growing income gap, because we too are experiencing that between the rich and the poor. And so our welfare state is going to have to work extra hard in order to ensure that that gap doesn't grow any further, and hopefully even minimize it further, in order that we do have everyone accounted for at the end of the day. And again, coming back to the social determinants of health, one of the key determinants is sense of belonging, social cohesion. And I think we do a whole lot better of a job of doing that here in Canada than our folks stateside. Certainly we have little pockets of success in the United States, but our psyche in Canada is fundamentally different with respect to taking care of one another and to taking care of the most vulnerable. We're constantly challenged with that, but I firmly believe our psyche is unique in that regard when compared to our American neighbors.
Okay, I'm going to completely turn the conversation back to an earlier topic, which is more on research methods. And so each of you do such important research using such varied methods. And I would like to hear from each of you, what are the current methodological challenges that you see now? And also what might be on the horizon in terms of methodological challenges?
I can start. So speaking about the current state of affairs and that we're facing the geopolitical crisis right now, and trying to understand what's going on and what organizations can do to help support workers and the most vulnerable, this is a hard time to collect data because people are busy. They're dealing with a crisis and they don't want to answer a survey or necessarily be interviewed. But it's so important to learn what's going on and trying to assess it. And I've collected research in the past on other crises that have happened. And I was mentioning in healthcare, it's not just been COVID, it's been H1N1, SARS, and it's repeating. And one of the biggest challenges is to have people participate in research because the time is so sparse. And I had one nurse in a sample. She was being told about my study, and people were listening and looking at some of the questions that I had because I had a little pamphlet. I was handing them out in a room, and a nurse threw down the survey and the pamphlet on the table said, "I don't have time for this. I'm saving lives. I can't do your survey." And they walked out and they stormed out. And then other people, they were looking at each other a little puzzled, and a few of them stayed. And after I was done my presentation, we were talking and saying how important it is to learn about your lessons and to share them across other parts of the hospital to help improve for everybody, not just specifically of what you're doing and trying to help this for the future. So for me personally, the research I focused on more is the crisis and that currently how hard it is to collect data. But during this time, it's really important so that we can learn and figure out as researchers and practitioners to help people in the future. So that's a challenge right now, specifically.
Yeah, no, I appreciate the notion of time. And people being very busy. And then I'll just say trust in science. Like, why is McMaster here? What are you doing? And having to almost pitch it to people, right? And understanding your audience. So maybe I'm going to learn some more from the business school about how to do that and frame my pitch. But I think to get to the people that might not step up to do research otherwise, we have to go to where they are. And yes, we can do surveys, but I know that online surveys and different things, but then now I've seen false, like people pretending to do lots, right, and answering surveys and all those kinds of things, and then us not being able to even identify that that's not the actual person we were aiming to get in the survey. So now I've gone through a lot of different complexities now, but trust in science, time, is the person, we want somebody's voice, but are they willing actually to step forward? Is that really their voice actually behind the scenes? So I'll stop there.
Yeah, I think just to build on what's been said, some of the key challenges that we've certainly been experiencing is, are specifically the fact that the workplace is such a dynamic entity now, with respect to so much change going on. So that's difficult to track, right? Even if you're doing a cross-sectional study, you're going to have so much diversity there, so much noise because of the amount of change that's taking place. I think the other issue that has already been alluded to is the gatekeeper, right? So particularly in healthcare, there's some pro-research organizations, and there's some organizations that are not interested at all in participating in the research enterprise. And I think we could say the same across multiple sectors. There's organizations that are very progressive and see the benefit of evidence-based data in making decisions, and others who are, more happy just surfing and, hoping that things are going to work out. I think the third thing that I've recognized over the course of probably the last 10 years is organizations are building their own research shops. So they don't necessarily need an outsider, even if affiliated with a Canadian university such as McMaster University. So a really good example of that is the Conference Board of Canada, which many academics used to collaborate with, but now they have their own research shop, and it's well funded, it's well manned, if you will, and so they don't really need to collaborate with university researchers anymore, unless, of course, they reach out to us, right? And I think the last thing I'd like to mention, and I do this very kind of carefully, because when we think about truth and reconciliation in this country, we all have to be playing a part. We all have a role to play in truth and reconciliation. But my experience in working with First Nations urban Aboriginal women in Toronto as a master's student at the University of Toronto very clearly communicated to me that I am only invited to participate in research with Indigenous First Nations folks. So as much as I feel and am engaged passionately with the cause of truth and reconciliation, I'm only able to participate when I'm invited to participate. And I find that really frustrating, because I feel I have a lot to offer, but I can only engage when I'm invited. So I think that's a real issue for us, because increasingly we are going to be required to engage, but we will only be able to do so in ways that are appropriate and specific, as outlined by our First Nation Indigenous colleagues.
So I'm going to pick up on the first 2 points and sort of start from my experience there, where the idea of not being able to actually have the participants that we need to do the research is problematic. And one project that I was working on with colleagues, actually it started with a finding that suggested in the literature that men and women were experiencing comparable levels of work-family conflict and consequences, which is surprising, at least was to us, just given that women's role in the workforce has increased, while to their domestic, time has not necessarily decreased at the rate that we would expect. And so looking at this finding that came out of quantitative research really did counter a lot of the qualitative research. And so using longitudinal data, we, of course, showed that what we presumed, the questions around work-family conflict require that you be working, right? And so you're not included in the survey if you are not working. So how do the women whose work-family conflict had been exceptional that it led them to drop out of the study or not participate in the first place, sort of counter or undermine this finding, right? So we're walking around sort of, having this conclusion in our mind about gender differences in the work-family interface and consequences, when in fact it's a fault of the method. And I think that we can, and not the method in terms of surveys, but the fact that we can't get to the vulnerable populations over time if they are unfortunately too vulnerable to participate in our surveys. And when I look at the research that we do on work and mental health, this is such a problem, right? And so, those people whose mental health has taken them out of the workplace, we don't get to follow up with them necessarily, right? Because they, in order to understand their circumstances, oftentimes these measures are designed for those who are working particularly, or those who are in, working for non-standard employment opportunities or the gig economy, right? These people are transient. It's very difficult to have them in a survey for a longer period of time. And so I think it distorts our conclusions. And I don't know if we have solutions to that just yet, right? And so it does kind of, it makes me a little bit more questioning of some of the findings that do come out of survey results, and ensuring that we take more mixed methods approaches to, I think, amplify or to sort of, from a multi-pronged approach, be able to validate those with more qualitative methods, for example.
And to build on this more, I've been thinking a lot about research methods, and I actually have a stream of my research portfolio on developing new research methods. And this is partly inspired by looking at organizational crisis. And certainly right now, today, as we heard with Oshawa Plant and just dealing with the geopolitical crisis, this is certainly a period many organizations are facing organizational crisis, no doubt. We look back to COVID-19, many of us face crisis. And also personally in healthcare, I've been studying this for a while, crisis of SARS and H1N1 across time. And so over the course of over a decade now, I've seen crisis come and go. We can learn a lot from this. But when there's not officially a crisis, I still hear the word thrown around, crisis, crisis, crisis. But I realize it's really a crisis of time. Are we using our time well? Are we really being efficient and innovative and productive in our time? And how can we do this better? And as a management scholar trying to help us be more creative and effective in less time, I realized this is very important to study, but I needed a lot of different research methods. And as I was using different methods to try to understand time pressure and crisis, which is very hard to get data, but as well a crisis of time and how we can be more effective and innovative within that time. How can we study this? And so I've had this new stream of research now with open science, where complete transparency, my data is public, it's on, you can download it, you can use it if you'd like, and very large scale methods and papers where we actually have pre-publication of our hypothesis. So you see transparently, we're being honest, there's no p-hacking, this is what we plan to do and why. And we've developed protocols in a series of papers to encourage other researchers to do this. But this is controversial because do you really want to release your data to the public? Not everybody wants to do that. So there's a lot of forces for and against that. But we encourage the pre-publication of research itself and hypothesis to encourage better methods and transparency and honesty so that we know participants are and researchers themselves are trying to encourage good practices. So I think this idea of open science framework, which is public, allows you to host your data or your pre-publication of hypothesis and registration, I think is a good movement in that direction. So.
Yeah, the only thing I'll say is I'll just go back to Marisa's point is, but who is the data? And in fact, if we're going to start calling that data, and of course, am I going to bring up artificial intelligence? I just said it, right? So now we're going to answer questions. They're going to be able to pull your data set, right? But who is the data? And so just something to think about. But I do appreciate the notion of open source data. I do feel that some people purport to do that, and then they require you to jump hurdles in order to access the data. So there's still a lot of controls in place, even though they've said, oh, I'm creating an open source platform, so to speak, and then not really, but sounds good. Anyway.
Yeah, so I suspect that the panelists are not the only people who have experienced any challenges with any of their research. So at this point, I can open it up in case anybody else would like to raise a challenge with their research. And it's something nice for me to know as director of MCREW, because if we all face similar challenges, there might be a way that we can band together to meet these challenges head on.
You know, Catherine, sometimes I just put the microphone in front of people and just to see, because usually they have something to say. Just sometimes I use that approach. You're much more democratic. Yeah, see? There you go. Good work.
Let's chat to my research.
Yeah.
Obviously, this is kind of a silly challenge, but I find that I have an increasing number of undergraduate now MBA students who contact me and would like to do RA work. And I don't know what to give them to do. And I feel like it should be like win-win, right? Like they're getting experience, et cetera, I'm getting some work done. I don't know. I would just love to hear from people who have like successfully used students in research. Because I just end up working with PhD students most of the time because I know that they need, like, it's easier to explain the work that you want done and I can like rely on the quality, but I'd like to give opportunities to other students. I just am like, I would love to hear ideas of what people are doing with undergraduate students.
So we can definitely talk later, because MCREW has a student for you. And it's one of the things MCREW does is we provide RA support for MCREW members. So we have one, and she can work for 20 hours a week for you for at least 1 week. So far, people have been hiring the MCREW student to do lit reviews, clean data, help with kind of the preparation for the launch of a project. So there might be some opportunities for you right there. Not that MCREW can solve any other challenge that people might mention.
And Catherine, can I just respond real quick? So we have a similar situation at the center where we have tons of students, or not tons, but we have quite a few undergrad students who are emailing us and they want opportunities, they want to build their CV, and I'm just like, I don't know how I'm going to find time to supervise you or, give you the skills that you need in order to work on these tasks. And so we actually created an Avenue to Learn page with some modules. And then so the students are required to then take the modules and kind of develop some training. And then each is kind of associated with maybe a task that has, a member has said that they need help with. And then we also use more senior students to supervise the undergrads, right? Yeah. So, those are just a couple of suggestions. So I'm happy to talk as well later. Yeah.
So I started out as an undergraduate researcher, like Catherine, and now that's PhD. So I've kind of gone through some of the levels. And so I think some of the good things was to see the project kind of from start to finish, even if I wasn't really all that involved, if I was like a new undergraduate student. Learning that was good. And then we also have some of the undergraduate students that have done some research and they have ideas that they might help, what they want to be able to learn and what they want to do.
For me, I would probably say just being involved and being able to see behind the scenes, because there's more than the classroom, and we read paper if you're at class, or we learn to critique them, but to actually see the behind the scenes, very exciting as undergraduates. And also even literature reviews, even like helping out with things like that is always exciting. And undergraduates are always excited to get involved. And so like things like cold emailing professors is something that they, spend hours thinking about. So every little opportunity is always appreciated as Dr. and that is to make for sure.
So we actually did our thesis with Dr. Konglu this past year. And I think one of the most exciting parts as an undergrad was the beginning to the end, like Sarah mentioned. And it's just intimidating to get into research as an undergrad because it's so emphasized, especially at an institution like McMaster. So more than just, I've done one to many literature reviews to the point of I did close my eyes and I'm reading it. Which is always exciting, but doing gap analysis or even designing a study and then being able to contribute something. It doesn't have to be something huge because we don't have anything under our belt to put leverage into our research. But I think just being able to interview of professionals and just sitting in on conversations, it's so much more valuable than in me seeing, especially if it's coming from an undergraduate perspective. So yeah.
Hi, I'm Johnny Carisi. I'm currently acting dean of science. I just wanted to raise, from on the heels of the comments from the undergrad students, in science earlier this year we launched the Office of Undergraduate Research, and that office, I'm not familiar with it, has a series of 1-unit stackable courses that undergraduate students can take starting in year 1. So you get meaningful research experiences for year 1 all the way through your program. I think it's something that the rest of the university should look at across all faculties, but it might be something they may want to consider on smaller scales.
Well, now that you're in a new position, maybe. Hello.
Yes, of the people in the room who might be able to achieve what you said, that would be you. So, but I think there would be many takers for that, for sure. So would anybody else like to talk about research challenges that are exacerbated by the current climate, or the research that they're doing? It's an open, friendly forum. But failing that, we'll just have more conversations during the reception or later on. And I'll move on to the next question, which is a little bit more optimistic. So, based on what you've observed, what do you think we have to look forward to in the world of research? So it doesn't have to be in your own topic as you define it, but in research in general. So what are the reasons for optimism when you think about the current challenges?
So this was another question I had to think quite a bit about because I know, sociologists, we're the bad news bears people. And so in terms of thinking about optimism, and I think of, so my mother-in-law, she always says this to me, she's like, we broke it, now you fix it, right? And so I think the optimism is the next generation. And when I'm in the classroom and I see the excitement from the undergrads and I see, the graduate students who are so passionate about the current situation that we're in and wanting to do more, I think I see optimism there and I think that's an obvious to just kind of like, transfer it to the next generation. I don't mean it that way. I think that it's just kind of such a renewal of energy and desire to ensure that, at least in the mental health research field, that they really care about workers' mental health and well-being. And it's really exciting to feel that energy. A second thing that I'm really excited about when it comes to research, I'm really excited about AI. I know that this is not everyone's bread and butter, but I am really excited to be working with it. I'm learning new methods that I never thought I'd be able to have time for, because once you're at this position, you just don't have the time to necessarily take courses or learn it from a textbook. And it's really phenomenal how much more productive I feel. And so I had said earlier to colleagues, like, time is a currency, and I'm feeling like I'm actually kind of getting a little bit more of that in my pocket because of some of these new tools that are coming out. So I'm really excited about that.
Can you just tell us a little bit more about the AI thing? Because I think that would be very interesting to a lot of people here.
Yeah, so for example, when it comes to programming, because I am a statistician, it's really easy to, I wouldn't say really easy, it's very beneficial to use tools like ChatGPT in order to get that done. I find that, there are tools of being able to do lit searches that you might otherwise have, and undergrad too, sorry. But if your funding is unsuccessful and you can't hire an undergrad, this is a great way. And then I also think that there are unique ways that we can, and I know there are debates about this in terms of, hindering our creativity or helping to sort of encourage it. And, some of the brainstorming conversations that I literally have with ChatGPT when I'm driving home just to think through a research problem, it's really beneficial. And it doesn't take away from what colleagues can provide me, but I do think that it's a tool that we're going to have to learn how to integrate it, and we're going to have to teach the next generation how to use it properly, because it's kind of like smartphones when they first came out. Like, nobody could live without a smartphone now, and that's going to be, I think, the way of the future. But there are a lot of people who have different views on this. I'm happy to hear that as well. But I think when used effectively, it can be a really, really great tool for research and for teaching.
Great, thanks. So I've got a couple ideas here. First, I think from a more macro perspective and thinking about research more broadly. one thing that I've become really, really excited about is the importance of doing good knowledge translation research and good knowledge translation work. And certainly, I'm primarily funded through the Canadian Institutes for Health Research, although I receive a lot of funding from the Social Science and Humanities Research Council. And about 10 years ago, they basically put in place that we are now required as principal investigators to do the knowledge mobilization piece as well. And there was a big push with respect to not only expectation, but some, additional direction around how to budget for this, and even some small research grants around knowledge translation and knowledge mobilization. So we're all doing it now. And some of us are much more successful at it than others. And that gives me great hope, because I'm an applied researcher, like in my heart. That's what I do. I do research in order to change the world. So my research always has a very strong practical element. So the knowledge mobilization and translation component is something that I'm almost thinking about even before I put pen to paper when writing a grant proposal. So to me, that's really exciting. And it makes what we do here at the university significant and relevant, which makes, our provincial government feel a little bit more positive about what we do. I think the other really exciting change that I've witnessed, particularly in the last 5 to 10 years, is the importance of community engagement in the work that we're doing, which goes hand in hand with the knowledge mobilization work. And that also speaks to the importance of partnership research and the importance of interdisciplinary collaboration. Because if we're going to be solving the wicked problems, not only in labor and the workforce, but also in the world more broadly, I'm thinking here about climate change, for example, health inequities, for example. This is where we need to have collaborative interdisciplinary research, where the best minds are coming together and working in a way that is fusing strengths. And I think that's really where we need to be going. And I learned that primarily in an interdisciplinary population health research unit, where we had a data miner, an anthropologist, a sociologist, a community epidemiologist, an economist, and myself, a health geographer. And it was such a rich learning environment, and we made some very significant impacts as a result. It was also extremely challenging, but it was very worthwhile at the end of the day. And then when we speak specifically about MCREW and the work that we're doing around the workplace and labor more specifically, I think I find excitement in the opportunities specific to a horizontal workplace. So, we've all traditionally been working within a hierarchical workplace, but there's some new research now that really speaks to excellent outcomes around EDI specifically, and health and workplace satisfaction around a horizontal workplace where employees have voice. Their voices are asked for and they're acted upon. And this has really been very dominant in really progressive workplaces, specifically who have honored and capitalized on EDI. And these horizontal workplaces are succeeding. They're showing us what we need to be doing differently. And if you're interested in reading more about this, there's a really excellent book by Angela Jackson called The Win-Win Workplace. And she outlines some very specific pillars, which includes the importance of EDI and employee voice.
Yeah, no, I mean, what an in-depth answer. And I was thinking about community engagement, but I was also thinking about that we have these pockets of excellence. And I'm really excited to work on this most recent project because Thrive is seen as a as a center of excellence, and in fact, they've named and framed a center of excellence within long-term care, so to be able to unpack that and look at their strengths, right? So not just come from a deficit lens in terms of that workplace. Why do people feel a sense of belonging? Why might they come back to workplace even though the pay is lower and the benefits and they're still in an area of precarity? Why do they continue to want to stay? And so I think to come at it from a strengths-based approach, which I know is a bit cliche, but nonetheless, sometimes a good cliche is a good thing, just like, well, I won't continue that sentence, I'll stop there, but so just, taking a look at the centers of excellence and trying to unpack it a bit more just so that others can learn from that.
And building off Catherine's idea that she brought up earlier about research methods, I've been thinking a lot about big problems and what we can tackle now with the advances in research methods. So when we were in graduate school back in the day, there was a certain level, but as the methods are increasing and the chapters are added to our books around methods and statistics, we're able to look at problems that are more complex that we previously couldn't examine when we were decades ago. And as we think about the advances across research methods, I'm really excited by looking at these bigger, more challenging problems that we previously couldn't look at. And myself looking at crisis and thinking about being in the Canadian economy now, and specifically with healthcare, and hearing about bureaucracy, as we heard about earlier, and a lot of the rules and constraints that, as we think even about family doctors and a lot of all the extra administration they have to do beyond the actual seeing the patients, and thinking about going forward and trying to study this and trying to look at new methods to figure out what we can do to help assuage some of the bureaucracy and what we can do even within that. So as I look across other sectors and industries and bringing this to healthcare specifically, I'm really excited by the new methods. So, for example, I think about other industries, autonomous teams that are a little bit removed from healthcare itself, and that they're able to operate more independently. And certainly the Ontario Health teams have a lot of opportunities of going forward, but it's also being so new and looking for results right away, and it's still figuring out what's going on. But I think there's great scope of being able to look at some of these new tools to help us be more innovative in the future, whether that be methods or different sorts of approaches to examining organizations. So I think there's a lot of positivity and opportunities.
Okay. I'm so pleased to hear so many positive answers, sort of as an antidote for our usual problematizing that we like to do. What about the rest of everybody? What are you optimistic about?
Big organizations like Vrkljan and are coming up with perhaps like fine-tuning where we can use AI for assessing students at a larger scale. And it is perceived as more ethical because such big organizations are coming up with their own acts. But academia has a little bit of negative attitude towards use of AI, and that kind of creates the rift in students because they're constantly being exposed in LinkedIn and other platforms how AI can help in their research. I was wondering how can faculties integrate AI in classroom in a healthy manner and encourage an ethical use of AI thereby, instead of shunning the whole thing and creating more unethical use.
Oh my gosh, you don't want me to actually answer this, do you? Because I don't know if I am the expert to sort of say at university level how that should be dealt with. I know that we've had some really, really good task committees that have tried to figure out ways of introducing, different protocols around use of AI. So I'll just speak from my experience, and the way that I introduce my students to it well, I guess I'll say I do encourage faculty to use it. I notice that there are some divides that are happening in conversations where there might be an AI, sort of an anti-AI attitude that isn't really grounded in the attempt of even using it, right? So it's just kind of more ideologically anti. And I think that can begin to create a division between students who are excited to use it and faculty members who aren't approving of it. So what I do is I want my students to use it properly, so I introduce it in such a way of, here are some examples of ways that you can use it. I teach a PhD stats course, and so it is somewhat conducive to that when students don't really understand the material, definitions, or if they're, there's anyone else who knows programming, it's like the one comma that's out of place or anything, that it's like now you've got students who are coming at you because they don't know what's wrong with their program and they spend hours on that, right? And this is something where it's like there is a simple fix where, oftentimes an app like ChatGPT can find that mistake very quickly. And so I think that those are some of the lessons that I'm slowly introducing to kind of try to help, also my colleagues think more positively about this technology, because I don't know if I'm going to be convincing to them, but I think that these small approaches to introducing it into the classroom will be helpful. But I'm curious what other people think too, because I know that this is a hot topic right now, especially in the university context.
Yeah, what do you think?
He wants to reply.
Oh, yeah, sure.
I'm sorry, I related it to student context only, but if you see job editors and reviewers are also like very anti-AI, whereas many authors are coming out with their transparency of how they have integrated AI in their research. That's like a global approach, how to make it ethical. So, also you can touch on that, how to change the attitude of editors and reviewers in our.
Yeah. I also want to be mindful. I'm an editor-in-chief of a journal, the Canadian Journal of Occupational Therapy, and all we want is to acknowledge that we're using it, to be perfectly. So we are totally open to people using it. In fact, we just published an article that surveyed occupational therapists about how they're using artificial intelligence. So that's direct to the topic, and their openness to using it. But even within writing we're completely open. We just want to hear that people are using it and how, right? Should be part of the methods. It should be cited as to which platform they used. And I just want to be mindful of saying like all editors or all whatever. I don't think I can speak for myself anyway.
Okay. This has been a really excellent kind of MCREW kind of discussion. I've just really appreciated hearing all the different perspectives that you could imagine being brought to bear on an issue that touches everybody. And I can see how, with all the challenges we have with research, AI, it's just this, wouldn't it be nice, right? If it could represent data, if it could be unbiased data, if it could be quickly done, and if it could save a poor undergrad from having to do one more lit review. So I look forward to more of these discussions, and I'd like to thank our panel for their participation.